topic number 6, which is spine pathology. And obviously CT scan CT scan shows mostly the fractures. So we'll see today fractures on CT spine, and tomorrow on MRI spine we'll see other pathologies. So as it was discussed in very detail by Dr. Babar, that the atlas doesn't have a body. It has an anterior arch and a posterior arch. So any fracture that involves the fractures of the atlas are in itself called Jefferson fractures. Okay, they are known as the Jefferson fractures. Here it is, Jefferson fracture. So the Jefferson fractures are nothing but the fractures of the atlas. They can involve the anterior arch, they can involve the posterior arch, they can involve the lateral mass, okay, or they can involve the entire vertebral body that can cause a burst fracture. So these fractures are known as the Jefferson fractures. So here we can see there are multiple types of Jefferson fractures. There can be fracture type 1, which involves the posterior arch alone, then type 2, which involves the anterior arch alone. Type 3 involves the posterior as well as the anterior arches, and type 4 involves the lateral mass of the atlas. So we can see here on the CT scan, this is the axial cut. This is the anterior arch of C1. This is the posterior arch. And here we can see that there is discontinuation, or there is disruption of the anterior arch, and there is a fracture over here and over here as well. So the fracture that is involving the anterior arch only, that is known as the type 2 fracture. So this is how atlas fractures are seen. Again, the Jefferson fractures, if there's a fracture that involves the anterior as well as the posterior arch, a type 3 fracture. Again, a fracture involving the anterior arch, and again we can see here the anterior arch as well as the posterior arch is involved. So these are called Jefferson fractures. Again, on CT scan, this is the CT scan axial cut. This is the CT scan coronal cut, right? So an axial cut, this fracture is Jefferson type 4 fracture because it is completely involving the lateral mass, right? So this is the Jefferson type 4. Again, see this lateral mass is completely disrupted or burst. So this is a type 4 Jefferson fracture again here. But the good thing about them is that at this level, the canal is very wide. So even though they can look horrible, the patient doesn't have a neurological deficit, mostly doesn't have a neurological deficit because the canal is very wide and there is not much compression to cause symptoms. So uh, in just to say that this dome-shaped structure is the odontoid. Again, we have this, and in the axial cut, we can see this circular structure. This is the odontoid. And then we have a ligament over here. This ligament. Can anybody tell me what ligament have I drawn here? Anyone? What's the ligament that I've drawn? Okay, Dr. Reis. Tail. What is tail? Can anybody tell me the full form of tail? Tell me the form of tail. That's transverse atlantal ligament. See, it's not difficult, ठीक है? जो ligament का नाम है, वही उसका काम है, ठीक है? It is called transverse because it's transverse, right? It is called atlantal because it is at the level of the atlas. It's ligament because it's ligament, ठीक है? So it is transverse atlantal ligament. Now, what is the function of transverse atlantal ligament? Basically, it is the one that holds the odontoid in its place. तो odontoid को अपनी जगह पे रखता है, and the movement that occurs at this joint between the atlas, okay, and the axis, that is the C2. The movement that occurs at this joint shows rotatory movement. This no movement, okay, this is the movement, that is rotation of the neck, and this is seen at the atlantoaxial joint. Now, this ligament is very important. If there is any fracture that is disrupting, any trauma that disrupts this ligament, that results in dislocation of this joint, or in other words, it is known as atlantoaxial subluxation. Atlantoaxial subluxation. So that's why you should remember 10. Okay, so we back to the atlas fractures, Jefferson fractures we have seen. Now coming on to the odontoid fractures. The odontoid process can have three types of fractures. The one that involves the tip, okay, that's the type 1 fracture. The other that involves the, you can say, base of the odontoid, okay, that is the type 2 fracture, and the one that involves the body of the axis, that goes through the body of the axis, that is known as the type 3 fracture. So again, this we can see, this is the tip, okay, this is the front view, that is the coronal view, and this is the sagittal view, the lateral view, the anterior view, the lateral view. So again, the tip of the odontoid, yahan pe bhi we can see the tip of the odontoid. So that's a type 1 fracture. Again, here at the neck of the odontoid, here again, and then this is the type 2 fracture, and this along the body of the axis, this is the type 3 fracture. Achha, type 2 and type 3 fractures can be can mislead somebody, because if you see the lateral view na, this fracture and this fracture, they look very similar. This fracture is easily definable, okay, it's involving the tip, but these two fractures can look very identical on CT scan. So never ever rely just on the sagittal cut, always see the coronal view, because here you can see that this is just involving the base or neck of the odontoid, but here you can see that it is a wide fracture that involves the body of the odontoid. So always see all the images, axial, coronal, in order to clearly label what kind of fracture you are dealing with. So this is an X-ray. This is an open mouth view. Why open mouth? Because this is the mandible, right? So the patient has opened the mouth and then the X-ray is taken. So this is basically the X-ray that shows the axis, the first 2 or 3 cervical vertebrae. But obviously the important is the CT scan. So this is a sagittal cut, as previously explained beautifully by Dr. Babar, that this is the anterior arch of the atlas. This is the anterior arch of atlas. This is the posterior arch. And this tomb-like structure is odontoid. But what's the problem in this particular tomb-like structure is that there is a fracture. Okay, but this fracture can be type 2, it can be type 3. So how we are going to decide it? We are going to see the coronal cut. Now here you can see that this is involving the neck of the odontoid. So this is a type 2 fracture. If it would have been here at the base or at the body of the axis, then it would have been the type 3 fracture. Again, this is a 3D constructed view, and this again shows this neck of the odontoid, fracture of the neck of the odontoid. This is a type 2 fracture. This is an MRI we'll see in detail tomorrow, but this is how it appears. You actually, bony anatomy is not much clear on MRI, but you can have some kind of bony changes if there is a fracture. So this was about the odontoid. This is a better picture of the open mouth odontoid view. Now see, can anybody tell me what type of odontoid fracture is this? It should be now clear by now, I think.
Type 3.
Type 3.
Type 3, yeah.
Excellent, excellent. Okay. So this is type 3, because see how easily now we can see that this is going through the body of the axis. Okay. So again, even on this open mouth view, you can see how beautifully it is being shown. So this is how you identify the odontoid fractures. Okay. Okay, so this what kind of fracture is this one? A.
Type 1.
Type 1.
Excellent.
Type 1.
B.
Type 2, neck
Okay.
of.
Excellent.
And this is the body fracture type 3.
Type 3. Excellent. So I hope this is clear by now. I've put in pictures again and again. I've put in pictures so that it can become very clear to you, right? So this is going through the body. Okay. again, but this देखो इस mid sagittal पे you cannot actually say this is type 2 or type 3. Okay, so whenever you see, you can obviously say that there is a fracture of odontoid, but what kind of it is, you have to see the coronal. So this is very important. Now this is a CT scan of this patient, okay, and this is a CT scan of this patient. So it's very important that you should see the coronal cuts. Okay, then we have a type of fracture that involves C2 as well as C3. It's known as a hangman fracture. Now, what is a hangman fracture? Previously, the mechanism of injury of hangman fracture was hanging, but जो कहते हैं hang till death, ठीक है? So that is the cause of hangman fracture. But there are a few other causes as well. The basic mechanism is hyperextension injury. Hyperextension injury that causes disruption of this part of C2. This particular part of C2 is known as pars interarticularis. Okay, so if it is written here, it's not written here, but pars interarticularis is basically, इसका नाम जो है pars है, ठीक है? Pars, pars का मतलब क्या होता है? Part, ठीक है? Pars interarticularis. Inter means between. Articularis का मतलब होता है joint. Basically, there are two facet. There is a superior articular facet, right? And there is an inferior articular facet. So the part of the bone which is between these two facet, that part is known as pars interarticularis. Pars interarticularis. So this part basically, this is the, here we have somehow roughly, if I can say, this is a superior articular facet, the inferior articular facet, okay, superior articular. So this part of the bone is known as the pars interarticularis. So the fracture that involves the pars interarticularis, and obviously जब pars interarticularis का fracture होगा, obviously it will cause instability of C2 C3 joint, and the C2, that is the axis, will be dislocated or subluxed. Okay, it will dislocate uh, from its position, normal position, and there will be subluxation. So hangman fracture is a combination of two things. Okay, there is a fracture of pars interarticularis, number one. Number two, there is C2 C3 subluxation. C2 C3 subluxation. So the two things combine to form the hangman fracture. Okay, we'll see in the subsequent images that how it appears. Okay, so is it clear now? See, this is the fracture of pars interarticularis of C2, and see how it's not that severe, but still a few of the lines that were discussed by Dr. Babar. Okay, this line, it is the anterior vertebral line. Okay, then this line, sorry, it's bit, okay, this line, and मेरी खुद की line टेढ़ी हो रही है, but this is the posterior vertebral line, ठीक है? So here in the interspinous and supraspinous, I'm sorry, I'm not able to draw, I don't know why. So the point that I want to make is that this line there is no alignment in this particular set. So there is dislocation or subluxation of C2 over C3, number one, and number two, there is a fracture of the pars interarticularis of C2. So this is a type of fracture that's known as the hangman's fracture. Again, I think there was another picture, but I've somehow missed it. But this is a very this is not that common fracture, but it's a very radiologically very favorite question of many examiners, how to identify hangman fracture. So then we have subaxial spine. So obviously cervical spine is divided into C1, which is atlas, C2 axis, and C3 to C7 vertebrae. They are collectively known as subaxial because they are below the axis, so subaxial spine. So there can be any type of injury. There can be hyperflexion injury, hyperextension injury. These are the lines that we discussed previously: the anterior posterior vertebral line, spinolaminar interspinous line, or posterior spinous line. So why are they important? Because see here, if we see, there is there is loss of alignment of that line. I pray that कि मेरी line सीधी बने. Okay, that's good. So he see this here, this vertebral body. Okay, this is something very off center, and this is coming anteriorly. So when you see that there is misalignment in this line, again, if we see even in the posterior vertebral line, this is the posterior vertebral line, but यहाँ पे आके, okay, यहाँ पे exactly this is disrupted. So it means that there is some kind of misalignment, and there is some instability in the spine. So there must be a fracture or a dislocation. So in this particular image, we have a disruption of C5 C6 joint that is causing C5 C6 subluxation. Now this is C2, the tomb-like structure. This is X-ray, right? This is X-ray lateral view, and this is MRI. So I'll be focusing on X-ray. This tomb-like structure, we've discussed that this is the odontoid C2, and then you count from there. So C3, C4, C5, right, and C6. So this is how you define okay, what kind of vertebrae is having a dislocation or fracture of that particular joint. So again, this is an MRI, and MRI पे भी वही चीज आपको नजर आ रही है. That is the disruption of the C5 C6 joint, and there is subluxation. Another type of fracture of cervical spine is called a teardrop fracture. Teardrop means a drop of tear. Okay, so this is, for example, this is the normal vertebral body, but इसका small part of it is taken off, right? This is a small chip of bone which is being torn out of the main vertebral body. So this is a teardrop. It looks like a teardrop, like a vertebrae is fractured and now it's weeping. So this is called a teardrop fracture. So they are very they are not that much symptomatic, but yeah, they can be sometimes surgical. Then we come to the thoracolumbar spine. Thoracic and spinal lumbar fractures, they are mostly they're very similar, and they are studied together. There are four important types. Number one is the compression fracture. Now, to understand the thoracolumbar fractures, we have to understand the three columns. The three columns. Now, what are the three columns? जैसे कोई बिल्डिंग होती है तो उसके कॉलम्स होते हैं, ठीक है. तो हमारे स्पाइन भी जो है हमारी इस तरह से हमारा कॉलम उसमें होते हैं जो कि हमें स्टेबल करते हैं, जो हमें खड़ा करते हैं. सो देयर आर थ्री कॉलम्स इन द स्पाइन. ओके, देयर इज एन एंटीरियर, मिडिल एंड अ पोस्टीरियर कॉलम. ओके, सो दिस इज आई शो हाउ वी डिवाइडेड. सो तीन, जैसे हमारी जो है बॉडी हमारी बिल्डिंग है, ठीक है, एंड वी हैव थ्री कॉलम्स टू सपोर्ट आवर बिल्डिंग. देयर इज एन एंटीरियर कॉलम, then there is a middle column, and then there is a posterior column. So anterior column, these are arbitrary lines. Now what is in the anterior column? Anterior column contains anterior half of the vertebral body, anterior half of the intervertebral disc, and a ligament which is present here. What ligament is present here? Can anybody tell me what ligament is present here? Yes, Dr. Sana, your voice was distorted.
Interior longitudinal ligament.
Yes, excellent. Okay, so we have anterior longitudinal ligament. So then we have the middle column. The middle column contains the posterior half of the vertebral body. Now mind it, it's middle column, but it's involved, it is containing the posterior half. Okay, so the posterior half of the vertebral body, the posterior half of the intervertebral disc, and this ligament which is posterior longitudinal ligament. बाकी जो चीजें बच गई, they are in the posterior column. Rest everything is in the posterior column. The posterior column includes the spinous process, okay, the transverse processes, the facets, okay, and the spinal element, the ligamentum flavum, the interspinous ligament, the supraspinous ligament, everything is in the posterior column. So this is known as the Dennis, sorry, this is known as the Dennis three-column theory. Dennis three-column theory. Now, what did Dennis say? K two render or to declare a spine unstable is when there is injury of two or more than two columns. That is, we have three columns of spine. If there is fracture of two or more than two columns, then it will result in instability of the spine. So the fractures are divided based on what column is involved. So if the anterior column is involved, the fracture is known as compression fracture. If the anterior and middle column, they both are involved, then it is known as a burst fracture. Okay. If three column injuries are there, then they are known as seat belt and fracture dislocation injuries. Both of them, seat belt is also involving all three columns, C, anterior, middle, and posterior column. Fracture dislocation is also involving all three columns, but the difference is that in seat belt injuries, there is no dislocation. Okay, but in fracture dislocations, there is dislocation, there is the two vertebrae that are fractured, there is the joint is also dislocated, so there's no alignment. So this is how you divide these different types of fractures. So I hope this is clear, because this is how you describe these fractures, and this is how you see them on CT scan. Now I'll show all of these fractures on CT scan. Now this is a compression fracture. Okay, we said that compression fractures involve just the anterior column. So that results in wedging of the you can say the spine. Now what is wedging of the spine? Normally spine ऐसे होती है, लेकिन जब anterior column का ऐसे fracture होता है, when there is a fracture, then the spinal the vertebral body becomes like this wedge shape. This is known as wedging of the spinal of the vertebra. That is a wedge fracture. That's why compression fractures are known as wedge fractures, right? So see, this is a normal vertebra block in a shape, a square shape, beautiful square shape. But see here, this is normal, but this again is not a typical wedge shape, but this is the fracture that is involving just the anterior column. So this is a fracture which is known as the compression fracture. Okay, can I ask what is the vertebral level? ये फ्रैक्चर किस लेवल का है? कौन सी वर्टिब्रा है?
मैडम L4 vertebral body.
ओके, L4 क्यों?
बिकॉज सैक्रम के बाद डिस्क स्पेसेस नहीं है सैक्रम में, उसके ऊपर डिस्क स्पेस है, फिर वो L5 है मैडम,
ओके
और फिर वो L4 का. Yes,
Okay,
ma'am.
excellent, excellent. ठीक है. So this is how this Dr. Babar already told कि you have to, there are two ways to count the vertebrae. Either you can go from below by counting from sacrum, or you can come from above by counting the odontoid. So very good. So this is a fracture of the L4, compression fracture of L4. Okay, then we saw this compression fracture again. Now this is a burst fracture. Now burst fracture, I told that there is involvement of anterior as well as middle column, and the body is basically burst. The vertebral body is burst. We can see in this image the vertebral body is completely burst into different pieces. Okay, and this is the axial view. So this is the anterior and middle column fracture. And then we saw flexion distraction and fracture dislocation. Flexion distraction injuries, basically they are also three column injuries. Fracture dislocation are also three column injuries. The difference is that in flexion distraction injuries और सीट बेल्ट इंजरीज, दोनों का एक ही नाम है, both of them are same. They are also known as chance fractures. So there are three names for similar injury: seat belt injury, flexion distraction injury, chance fractures. So they are they're all the same. So then the difference between the flexion distraction and the fracture dislocation is that here the alignment is at least normal. But here the alignment is lost because there is dislocation. There's fracture along with dislocation. Again, this is a burst fracture, right? We can see that the vertebral body is completely shattered into pieces. And this is the MRI. And see how these vertebrae appearing normal, and this is completely burst. So the last thing which we can see on X-ray or CT scan is spondylolisthesis. Now, what is spondylolisthesis? In not just in cervical spine, in our entire spine, there is a part which is known as pars interarticularis. Okay, previously we learned about this part in hangman fracture. Now here similarly there is a fracture of pars if there is a fracture of the pars interarticularis of any lumbar spine. Okay, if there is a fracture of pars interarticularis of a lumbar spine like this, then it will cause spondylolisthesis. Now, what is spondylolisthesis? It is the dislocation of one vertebrae over another. Simple, जैसे cervical में subluxation हो रहा था, there was dislocation of one vertebrae over the other like this. Similarly, if that subluxation occurs in lumbar spine, it is known as spondylolisthesis. And the cause of spondylolisthesis is the fracture of pars interarticularis. Now, how is it identified? It is identified on the lateral or oblique view of the oblique X-ray of the lumbosacral spine. There is an appearance of a dog. Okay, this is known as a Scotty dog appearance. So normally the Scotty dog is fine and happy, but if there is a fracture of the neck of the Scotty dog, okay, again you can see here, okay, this is a picture, or this is a Scotty dog appearance, right? So if there is a fracture of the neck of the Scotty dog, that is the pars interarticularis, ठीक है, इसकी गर्दन तोड़ दिया आपने, so that is known as the that will cause spondylolisthesis. So this, I think this is all about from my side about the traumatic spinal injuries. And if anybody has any question, they can ask. Or we can wrap up today's session. Dr. Bhatt, are you here?
डॉक्टर मैगजीन, आपने सीट बेल्ट फ्रैक्चर का जो सीट बेल्ट इंजरी के नाम बताए थे, तो फ्लेक्शन डिस्ट्रैक्शन,
जी,
सीट बेल्ट इंजरी, और तीसरा थर्ड क्या बताया था?
चांस फ्रैक्चर, चांस
ओह,
fracture, yes. Okay, any other question, or should wrap up today's session?
ये मुझे पूछना था, स्पॉन्डोलाइटिस में ये होगा कि सबलक्सेशन थोरेकोलम्बर एरिया की होगी।
जी जी, थोरेकोलम्बर एरिया जी।
मैंने कहा स्पॉन्डोलाइटिस जो है उसके अंदर सबलक्सेशन थोरेकोलम्बर एरिया में होगा, मतलब फ्रैक्चर
लंबोसेक्रल, यस। अच्छा डॉक्टर सना, यू आर सेइंग कि हैंगमैन फ्रैक्चर की पिक्चर शेयर कर दें, ठीक है, मैं ग्रुप पे भेज दूंगी। डॉक्टर रईस, थैंक यू। अच्छा डॉक्टर सना, सीटी स्कैन मेन टाइप्स समझी नहीं मैं। डॉक्टर सना, आर यू हियर? अच्छा, okay. So I'll share pictures of hangman fractures if I find any good pictures. I'll send it in our group. So that's all for today, Dr. Babar. So wrap it up. We are way ahead of time.
हाँ जी, ओके, लेट्स कॉल इट अ डे, और कल इंशाल्लाह फिर एमआरआई पे डिस्कशन होगी। And again, we are really thankful to all the participants, especially Dr. Shakirullah, if I'm pronouncing it right. He has joined us from Nigeria. Dr. Saria has joined